work, but we actually use the iTrace a lot in our practice. And actually, this is a study that we're presenting here at the ASCRS. I want to thank you. Are you passing the slides? Or?
Yeah.
Oh, okay, it's here. Sorry. But basically, just want to show one of the softwares, and this is a really nice study that we're doing with different IOL profiles. I want to thank you, my co-authors, and Dr. Haddad is here. But basically, in this study, we're looking at true accommodation versus pseudo accommodation. We have in our control group 2 different populations, young subjects and just normal presbyope patients. And then in the IOL group, we have one IOL group, the ZCBOO IOL has a negative spherical aberration. The second IOL group is just an IOL with aberration free, the MX60. And then the third group is patients that had an aberration-free IOL in highly aberrated corneas. And we're looking at the depth of focus, an effective range of focus profile in all the 3 groups. So here's just to understand what we're looking at with this software. But basically, it's really easy, it's really quick. We take pictures, wavefront measurements, patients looking at a distance target and then at a near target. And what are we looking at here? Let's see if I open here. And we've been learning more and more. But basically, true accommodation, we see this shift in refraction. And it's basically, I don't have a pointer here, but it's the distance between the 2 peaks. And the effective range of focus is at, the 2 DOF curves at 50%. So let's look at some of our cases here. So this is just an example of patients in our control group, young subjects, again, near in distance DOF curves. And this is what we see, a really huge effective range of focus. Patients, they have like really true accommodation. Patients with presbyopia, as we can see here, very, very narrow effective range of focus. So it's nice to have both control groups because then we can look carefully at different IOL profiles. So here is the group of patients with negative spherical aberration. As we know, these lenses, they compensate for the positive spherical. Cornea has positive spherical aberration. The IOL is correcting spherical aberration from the cornea. So as we can see here, the VSOTF has a really high peak. Especially as they do very well, really high contrast, but with a very low effective range of focus. Now, if you're using an aberration-free IOL, now that cornea, the optical system has a residual positive spherical aberration, right? So these patients, they usually have a better effective range of focus. So then this group is actually really interesting. Patients with what we call highly aberrated corneas, patients that had hyperopic LASIK, or patients with keratoconus. So we usually use an aberration-free IOL in these patients. As you can see here, the VSOTF is low with a really huge effective range of focus. And now we are actually adding symphony and measuring different IOLs. But here, showing again that the ZCBOO lens has a really thin, really high VSOTF, the metric for quality of vision compared to eyes with aberrated corneas and aberration-free IOL. When we look at the distance-corrected near vision, really easy measurement you can do in clinic, but as expected, our young control group, they do very well, followed by patients with aberrated corneas and in the just aberration-free lens, and then the IOL with negative spherical aberration. Because as we know, a small, residual spherical aberration can enhance the depth of focus. And it's nice because we can correlate our clinical findings with objective measurements from the eye tracing. So here again showing our normal young eyes, the VSOTF, similar to the IOL that compensates for spherical aberration, and then as expected, low in highly aberrated corneas. So in summary, pseudo-accommodation is influenced by total high order aberrations, and increased depth of focus can help to enhance near vision functionality. In my practice, I like to customize IOLs according to patients' needs. I don't do like one, especially monofocal IOLs. I like to look at the cornea, look at the high order aberrations, internal optics to select the best IOL for that specific patient. Aberration-free IOLs, they can enhance the depth of focus, especially in highly aberrated eyes. And usually, based on this study, I kind of changed my practice. When I do monovision now, on my dominant eye, I like to use an IOL with negative spherical aberration. We have really the best contrast. And for the non-dominant eye, I use an aberration-free lens just to help me with extended depth of focus. Thank you very much.